Thank you, everybody, so much for joining us today. Today, I'm joined by Caroline. We're going to be going through transforming healthcare experiences and crafting a patient-centric digital journey. So a quick agenda, and then we'll dive right into it. So we'll briefly go over introductions for myself and Caroline. Then we'll cover digital front door, the security aspect from the CMS standpoint. Then we'll dive into a real-life patient experience. And then we'll open it up to discuss, what's next in this kind of industry space. And then we'll save some time at the end for Q&A. So diving right into it, my name is Kara Hall. I'm a senior product marketing manager at Acquia on the Drupal Cloud side of the house, specializing in the relationship that marketers and developers share when utilizing a platform to find the solutions for their digital experience. And Caroline, I'll let you introduce yourself.
Yeah, hello everyone. My name is Caroline Casals. I'm a software architect here at Phase 2, and I am a hopeless Drupal nerd. I've been working with Drupal in one capacity or another since 2012, and really excited to be here and talk about healthcare experiences in general, in specific. Yeah.
Awesome. So brief introduction into Acquia. Acquia is an open digital experience company that provides digital experience platform solutions to deliver your digital experiences. 1 in 4 Fortune 100 companies are Acquia customers. We have 1,200 employees worldwide, and 95% of customers are willing to recommend Acquia.
And a brief introduction to Phase 2. Like it says on the tin, we are a digital agency, and through our work, we have the great privilege of working with clients to help navigate their just fascinating and complex landscape of digital transformation. And Phase 2 and Acquia go way back. So Phase 2 has been a leading Acquia partner since its inception in 2007. And we've worked together on hundreds of projects throughout that time. I'm also honored to say that we were recently named Acquia's Partner of the Year. So thank you very much, Acquia team. I want to give you credit for that personally, Kara. And we, as part of that work and part of that partnership, we bring an understanding of how to maximize our clients' investment in Acquia, to customize that platform for not just, your, in this case, patients, but internal staff, and to create impactful user experiences using all that's available there. Our teams possess expertise across Acquia's growing list of tools and capabilities, from Site Studio to Acquia DAM, personalization, and more. So let's talk a little bit about so digital experience obviously covers a lot. Digital experience platforms can be used for a lot of things, but let's talk a little bit about why we are here today and why we're talking about this topic in particular. Those of you who are in the healthcare space perhaps can sympathize a little bit with what is often a little bit of a mismatch between what we want to achieve, what we're saying we're going to achieve, and the sort of reality that we have to contend with. So, we are being tasked when we're, taking on one of these projects to build something that's easy to use and seamless. It's as easy as 1, 2, 3, look at this smiling woman. She's got this beautiful slim tablet. Everything is sleek and modern and beautiful. But of course, the reality of healthcare is not quite that rosy. It's just really, really complicated. It's an intrinsically challenging and difficult industry to translate into a seamless, smooth, easy as 1, 2, 3 experience. So, how do we reconcile that? How do we do both? How do we make something that, from a patient perspective, is wonderful and easy to use and sort of low cognitive demand, and is pleasant and welcoming, while also not sort of, ignoring or skimming over or just, being dishonest about the complexity of, the reality of healthcare. So, again, delivering an exceptional experience. And, patients are coming to us with an expectation grounded in other contexts. So they are not, they are expecting a certain level of experience. They're not distinguishing, well, when I bought shoes, it was super easy to buy those shoes. That was a great checkout experience. that's specific to shoes as an industry, right? So how do we create those exceptional experiences, make it relatively easy to navigate the complexity, and critically ensure that it's secure? And Kara's going to hit on this in the end here, but healthcare faces a very real security challenge that is as ever evolving and is on a lot of folks' minds today with good reason. So with that, let's enter at least part of the solution to this task of sort of reconciling the expectation versus reality here, and that's the rise of the digital front door. Those of you who are here at this webinar, I'm probably have heard this at least in passing. A digital front door is a concept that's gaining a lot of traction and popularity in the healthcare space, and it's gaining that popularity because as an industry, it is a way of helping solve that problem that healthcare is really complicated, capital C complicated. So a digital front door is, simply put, to your digital experience what a lobby is to your physical experience, your physical space. It's that unified and hopefully pleasant, welcoming entry point to you and your services. So digital front door doesn't need to be everything, like the entirety of the hospital is not in the lobby. Maybe there are other rooms, so to speak, sort of behind that initial portal, but it's easy to find where you need to go. First impressions matter, and healthcare is, as I've hit on many times here, is complicated. A welcoming smile and a chair to sit in are always appreciated and can be the make or break of your experience. I can't think of any healthcare organization that doesn't have a really complicated digital landscape in that background. The problem is that our patients just don't care about that complexity. They are sick and scared a lot of the time, and they need an easy to use experience to get where they need to go. They don't have time to have all of that explained to them. A digital front door can be a pivotal part of that experience of helping them navigate that complexity. And it's not just good for patients. By making complicated information easier to find and self-service a viable option, we can reduce call volume to our help centers and just time spent getting appointments booked. Basically, efficiency is good for everyone. So getting started with building one of these is a process that's familiar to most folks who have been through these kinds of builds before, even if it was just, your old site 10 years ago, starting with what does our existing landscape look like? What are the areas that we can make easier through a little consolidation? What are the opportunities for self-service? So finding those places, finding those opportunities where we can make the experience better and not necessarily perfect is everything. And that's really, I think, the key to success. All right, so let's take this out of the hypothetical for a moment, sort of broadly what's a DFD, and let's look at a real scenario. So I'd like to introduce the work that Acquia in Phase 2 did with Gunderson. So Gunderson Health System is a health system based in La Crosse, Wisconsin, and their mission is to deliver world-class medical care and the right amount of love. They call it Love Plus Medicine, and it's their mission that really propels them forward. So they are a comprehensive nonprofit network based in La Crosse, Wisconsin area, but they serve the upper Midwest through multi-specialty group medical practices, a teaching hospital, regional community clinics, affiliate hospitals, behavioral health services, vision centers, and pharmacies. So it's a pretty broad network. Gunderson really was seeking a long-term solution that addressed the challenges of competing with digital-first native expectations of these online experiences that are easy, intuitive, and personalized. So their goals, expanding on that a little bit, again, step one is just that making that cohesive, one lobby, not 10. So really trying to create this unified access point so that, you, as a patient, that expectation wasn't on you to figure out where to go. To create, again, that pleasant, welcoming, warm, Love Plus Medicine is not stark, bare, painful waiting room plus medicine, creating this seamless experience that captures their brand and their identity as an elite medical provider, but without losing, that sort of more personal feel. And they are in a pretty competitive landscape there. And there's some big boys in their neighborhood. So really distinguishing themselves that way. And, crucially, they also needed a design system that allowed them to create that consistent experience across their digital touchpoints. So how did we accomplish it? What was the work that we had to do to make this happen? So, first and foremost, it was Drupal was the underpinning for this digital experience. So we built out that Drupal platform for them, moving away from a proprietary thing that was really brittle and difficult for them to manage, and of course the content migration into that. We did integrate with Kairos, which, if you're not familiar with that name, they are one of the sort of find-a-doc providers out there. So we integrated with that to create an experience that was sort of powered by that, but felt more seamless, was really sort of baked into the digital experience within the sort of DFD, digital front door ecosystem. So I mentioned before, we created for them an open source design system. We use that. We built that using Outline, which is Phase 2's sort of in-house open sourced design system framework. That's based on web components and lit. And so, okay, we've got the new digital experience platform, this thing, powered by Drupal, and this design system. How can we leverage that and make the two of them, work really well together? So there was some strategy work there as well. Enabling rapid content dissemination. This was really a critical need and one of the pain points from their older system. Again, I'm sure something that feels very familiar to folks who are currently, depending on where you are on this journey, if you're in the, I still have the 10-year-old thing. As mentioned before, that creating that provider search and scheduling experience, making sure that we had a cohesive brand. That's one of the benefits of consolidation. When you have 10 different things, you have 10 slightly different ways of presenting it usually. And last but not least, integration with Acquia DAM for their asset management. So that definitely the new DXP leverages that, but it went well beyond with just sort of what the DFD site needed to do. So, big project there that we worked with their team on, making use of that DAM integration. And so with all of that, so we had our goals, but what was the outcome of all of that work? I think that the response both internally and externally has been really positive to that work and to that project. But at the end of the day, we had we did have successfly created a new platform that made them competitive again and allowed them to compete in again pretty competitive landscape. Mayo Clinic is literally across the street from them. So there's a lot going on there. We also really took this focus on, I hate the phrase future-proofing, but making something that was going to be flexible and adaptable over time with their future needs. I think very frequently we see organizations stuck in a technology solution that I'm sure at the time was pitch perfect or pretty close, but just, things change, things are always changing. So creating something that was going to be flexible and adaptable over time. And we've already seen since go live, which was about a year ago now, we've seen that in action. So I think we were able to accomplish that pretty well. And, again, ultimately improving that consumer experience, that patient experience through that consolidation. The outcome of that is people are able to stay healthier because they're getting access to that care that they need they're not just putting it off because it's accessible to them. They maybe know about things that weren't otherwise available. Now, that's a lot of me talking about the work. You don't have to totally take my word for it. So Kendra, who's our marketing director, gave us this really lovely quote that, it's not just the development. So there were heavy development times with the CMS launch, and then there were times when we needed digital strategists and help with analytics and tagging. So the ability to flex between that was really crucial. And I think that that's important to remember. Obviously I'm a software architect. Everything goes through the sort of engineer lens there, but a lot of times the importance of these DFD projects is beyond. It is the strategy. It is the analytics. It is the for lack of a better description, sort of softer skills there, often really critical to the make or break. Now, we can't talk about building healthcare digital experience platforms, building these experiences out without talking about, and I mentioned it up front, the very real security landscape and threat landscape that exists for us today in this industry. So with that, I'm going to pass it over to Kara to talk about sort of, I got to do the front of the house. Kara and her team did what lies beneath.
Awesome. Thank you, Caroline. So diving into security on the CMS level, and then we'll get into security on the additional levels that you can provide to your digital experience. First, I just want to start by, level setting. Let's talk about all the way back to the beginning, right? So for 83% of companies, it is not when a data breach will happen. It is not if a data breach will happen. It is when. Sorry, excuse me there. And usually data breaches happen more than once, right? This comes from a cost of a data breach 2022 report. So a report from last year, I think this says it all, right? Data breaches happen often. You hear about them in the news and you rack your brain. Oh, was I there? Is my data at risk here? And when it comes to your healthcare data, nobody wants to even remotely begin to think about what are the effects if that healthcare data has been breached. How do you go about protecting that and making sure that, not only are you doing everything, but the sites or the organizations that you're trusting with your healthcare data, that it is being secured on that level as well, that they're doing everything they possibly can to ensure that your private healthcare or that private patient data is staying protected. So we talked about security threats, how, they're always out there, but what's more important about them always being out there is that they're continually increasing, right? The number of security threats grows every single day. There's always something new out there. There's a new way to try to, get into information, try to attack that data and how to access it. And, you need to make sure that your digital experience and the data that is in it is secure. But then there's also the challenge that budget and team sizes are not increasing. In fact, in some instances, budget is decreasing, team sizes are potentially decreasing. So then enters the issue of, your team or your resources and your budgeting are at one level, but then we talked about the security threats. It's growing every single day, right? So then it creates the gap. How does that gap be filled when, security threats are scary? They're new every day. There's only so many people. There's only so much budget. How do you go about filling that gap to ensure that the data is staying protected no matter what? But before we go into, exactly how that gap is filled, there's also understanding the cost of doing nothing to protect yourself from security threats. So if I don't do anything to fill this gap, what's potentially at risk, right? What is the cost of that? So the average global cost of a data breach is $4,350,000, right? That's not pennies on the dollar, right? That is a large chunk of change that is at risk for the cost of a data breach, right? And then the fact that to identify stolen or compromised information and contain the breach, that the fact that that is taking about 277 days, that's a lot of time, right? That's a lot of time for that information to be spread in places where it shouldn't be spread. And the average savings of containing a data breach in less than 200 days, so less than that 200-day mark, is $1,120,000, right? So there's a large chunk of savings there if you can get a data breach contained quickly. But then there's also the impact that a data breach or a security threat can expose your business to, right? If there is a data breach that happens, you have that lost customer trust and that degraded brand value. I'm sure we can all think about to many years ago on Black Friday, Target had that huge data breach and everybody was like, I shopped on Black Friday at Target. What does that mean, right? Like nobody wants to be in that situation. There were people who then didn't trust that organization. They didn't want to shop there anymore. Nobody wants that to happen with any data, let alone their secure healthcare data. And then there's the lost revenue from site downtime or higher costs from bad traffic. If your site is down because there was, a security threat that took it down, or you had to take it down to prevent a breach, all the things that happen, this leads to lost revenue. People could potentially be on your site looking for potential options, whether that's, shopping options, or in the case we're talking about today, better understanding maybe a recent diagnosis, or understanding where they can take their family member to get the best access to the best healthcare for what they've recently been going through. So all of those aspects together, we talk about jumping back to talking about filling that gap. Through the combined security power of Drupal and Acquia, you can rest assured that you're being protected on a variety of different levels. So there's the securing part, making sure that the digital experience remains compliant, and then there's additional add-on or advanced security measures that can be put in place to make sure that that gap is being filled to its most peak point. So the first level I'm going to talk about is the CMS security to meet organizational requirements. This is the Drupal level, right? Drupal is a CMS, it's open source that provides a variety of security aspects, right? So it's secure by design in that it is open source, and that ties into many eyes means bugs can't hide. There are multiple contributors that are actively increasing the security aspects of Drupal every single day. They're finding bugs, they're putting patches in place to prevent those bugs from turning into something that could potentially be more, risk adverse. And then there's the other aspects that are put into place in terms of features within Drupal that can help control your security as well. There's role-based access control, and then there are other additional advanced security features that help to make sure that it is secure at a base level. And then the last item I'll talk about on this slide is certainly not the least item, the Drupal Steward program. It's a great program they put into place. When Drupal finds a security risk, they send out an alert through this program that they have a patch that can be put into place, and then everybody who is using Drupal can take advantage of that. And us at Acquia, we are a member of the Drupal Steward program, so we are alerted that when there is a security item that needs to be taken care of, we get that alert, and then our platform teams can jump on it right away and start pushing that out to the platform so that nobody is affected by that potential security risk. The next level I'm going to talk about is the platform security to also meet, again, organizational security requirements. Here on the screen, you can see a variety of different security features that are built into the platform to ensure that it remains secure, such as multi-factor authentication, roles and credentials built in, real-time log streaming. I won't read them all on the screen. There's these, and then there's much more, right? Like this is just top of the iceberg, tip of the iceberg, right? All of that underwater stuff that we're not seeing is also happening on the day-to-day to ensure that your site is remaining secure. And then with the power of Acquia, you can get compliance accreditations to also ensure that your digital experience is meeting the industry compliance requirements that are needed. So you can see the long list here. There are several available. The one I want to double click into or look more closely at is that HIPAA compliance to ensure that those patient digital experiences, that patient data is not only being secure, it's also being stored correctly, and that it's meeting the compliance regulations for how it is stored on the back end. And then we talked about add-ons for more advanced security. This can be also put at that platform level. But again, these are those more advanced additional options that you can attach on to the platform that take it to that next level, really help fill up that gap. Maybe you don't have people to do it internally and you want to potentially look at an outsourced option to help provide security in that level, whether it's DDoS protection or an additional WAF or bot mitigation. There are much more than the 8 listed on this screen as well, but there are advanced security options that can help ensure that the digital experience is also being protected from potentially negative traffic. So with that, covered a wide range of security aspects at the various different levels, from the CMS level being Drupal, the platform level being Acquia, compliance standards, and then last but certainly not least, those advanced security aspects. It's great to talk about the back end, but how does that actually contribute to delivering a patient experience? What do patients actually engage with on a day-to-day? I'll pass it back to Caroline to walk through an example.
Yeah, and so this is a lot, right? We've talked to you all for 25 minutes right now. And I think one of the traps that I see us fall into when we're building these experiences and when we're keeping in mind all of the work that needs to be done, the security threats, the internal politics of, who needs to show up in the flight doc and all this stuff. I think it's easy to get distracted by that. and to forget what all of this is really for, which is creating a great patient experience. And it's not to say that all of that stuff, like I'm not hand waving away as if that doesn't matter. So that's clearly not true. But when patients are coming to our site, they aren't just users. Like what a cold technical term, right? They're just users, right? Like this bucket of objects that comes and visits. They're not coming to our sites, especially within healthcare as an industry, for funsies. Right? They are very likely in crisis. Not everyone. There's lots of wellness visits and other reasons why you might show up. But when we are creating these experiences, when we are thinking about who the real humans are that are on the other side of that screen, they are coming to us possibly hurt or sick. We're taking care of somebody who is hurt or sick. And they're if that's the case, they're probably really overwhelmed. And, the benefit of using these digital experiences to connect with our audiences is that we can have immense reach. But the trade-off to that is that the people we are reaching are invisible to us. I'm not seeing you, right? I literally can't see you. I can use analytics to kind of track your footprints, but I don't, it's not the same as having a conversation or looking you in the eye and seeing that person that I'm helping. So a patient's digital experience is part of that care journey. And that initial contact needs to be emotionally supportive and positive. And that is a tremendous responsibility for us as implementers. So, and if you want to go to the next slide here, we've got some examples of like, how does that, so if I'm creating a digital experience, am I going to solve the fact that somebody is hurt or sick? And, obviously, no, the actual on the ground, care providers are an intrinsic part of that and always will be. But even if we get things to be 10% easier than they were, that's potentially making a really bad day 10% better for someone who is in crisis. And I think, again, when we're looking at find a location, when we're looking at find a doc, it isn't, the engagement metrics are great. Our KPIs are great. And I'm not belittling that, but it's a lot more than that. And so when we're making these investments into making a great find a doc experience, making a great location find experience, we are helping somebody who is trying to find an urgent care clinic because their kid just fell out of a tree that they told them not to climb it, or they're trying to take care of their failing eyesight, or they're seeking hospice care for a loved one. So I think if you are on this journey somewhere, you are here because you are at some point in the process of creating a digital front door or creating a healthcare based digital experience. I urge you to, as much as you can, try to reground in the patient experience and the patient's life matters and their interaction matters. And that's not to say that the internal politics and all of that aren't important. But these investments aren't just being made, for our quarterly business reports. They're being made to help to help our communities. And as somebody, as an engineer who builds big websites, that's really inspiring that we get to participate in making that better. And again, I'm not, we don't get to, I'm not a nurse and nurses are heroes. I'm just going to say that, but I think that that's really exciting and really engaging. And, Carrie, if you want to go to the next slide, it doesn't just have to be the fancy features like open scheduling, even finding information, like here we have something on pregnancy and birth. If this is your first child and there are questions that you have, making that easier for people, helping, people figure out what do I need to do to prepare for a surgery? If you're not fortunate enough to have a nurse or an EMT or a doctor in your friends and family group, often you're left in the dark. And so in any aspect of this patient journey that we can improve through an application of, good design, good engineering, good content strategy, that has this sort of compounding effect, which, like I said, I find personally really exciting. And of course, we're never done. We sit at the edge of a constantly moving landscape of new threats, sure, but new opportunity as well. And for me, that's part of why I get jazzed about this stuff, and I'm really excited to be a part of that. So before we jump into the Q&A, Kara, I'd love to get your thoughts on, from where you sit, where do you see us heading as an industry? What are you most excited about? And maybe on the flip side of that, like what keeps you up at night, maybe a little bit? I'd love to hear that.
Yeah, I think one of the most exciting places we're heading is everything that's going on with AI right now. I think that there's, it's still a questionable subject, right? It can be kind of touchy.
For sure.
It's the security aspect of it is still under question, but the future is endless, right? There are going to be ways to use AI securely. And I think, looking at how, once that is determined, how can we use AI securely to benefit, ways that potential, healthcare organizations can take advantage of that, whether it's like you looked at this one site one time, like let's use AI to pull in some other areas to maybe break down that super complicated or perhaps intense medical language, right?
Yeah.
Like put it in there. It just automatically simplifies it on the website, right? The options are going to be endless with it. On the flip side of it, what potentially keeps me up at night, I think it's probably the same thing that keeps everybody up at night. How do we make sure that this information is always available, right? Like how can we make it as, sound and secure as possible? I mean, I know I touched on security, right? That's kind of where my heart beats a little harder for it, right? Because I know, what's at stake there, right? Like
anyone in the audience who's an on-call is like, yes,
right.
that, yeah.
Yeah. So it's important to, keep that in mind. But what about you, Caroline? I'm gonna, toss that same question back at you. Where do you see us heading? What keeps you up at night in terms of, our expanding landscape?
Yeah, and I do feel compelled to crack the joke that that we make internally at Phase 2, that all conversations must end in a conversation about ChatGPT. But I think, when I think about all of the advancements, and Kara knows this, we were talking about this before the webinar started. I come from a biology background. I'm a wayward biologist. I don't know why I ended up at Drupal. I love it. I have no regrets, but I shouldn't be here. And we think about the track of human history of medical advancements that have made, right? And it's like a total hockey stick. The fact that in our role and what we do now as marketers, as developers, designers, that we potentially get to participate in making human health better is incredibly inspiring and exciting. And we really do, I don't think that's hyperbole. I think that some of these, and yes, AI is definitely, it's not will it play a role, it's how it will play a role. That genuinely has the ability to help us live healthier, better lives, I think is incredible. And these tools are accessible to us. There's a prediction of the .com bubble equivalent of AI everything that, I'm sure there's a lot of, sounds like a good idea, but doesn't quite pan out, that we'll see develop. But for, every one of those, I think there will also be opportunities for, and again, a small team doing that. It's great if you work for Microsoft and you're building out these things and good, that's awesome, great for you. But, the clients that I work with, the teams aren't that big. We look at the web team, we look at the digital team. We're not talking about hundreds or thousands of people. We're talking about tens of people or dozen of people. And so the fact that small but mighty team could potentially, create something that allows patients to, self-diagnose things. I have a dear friend who had a very life-threatening health condition that went undiagnosed for months. And those are the kinds of things where I genuinely think our work, I don't mean technology broadly, I mean the digital experience platform circle could potentially impact those. That's very exciting to me. And just, making content creation easier. There's less like, ooh, sexy things, just making drafting content easier is something that we're seeing this application for. So very pumped about that. As far as what keeps me up, so I will say this is, I think the immediate thing is just there is blood in the water right now around, in particular, compliance around data security. And like my nightmare scenario is that, we run afoul of that. As the rules are, and the rules are changing day by day. I promised I wasn't going to spend a lot of time talking about OCR. I'm not going to do that. But, these are the kinds of things that are changing constantly. And what we do is very complicated. So having a partner like Acquia who takes so much of that off my plate is huge. And it lets me focus on, again, creating these digital experiences and not sort of playing defense on, is our data secure? Like, it's secure. I'm still anxious about it, but that layering in that protection, I think is huge. So yeah, that's my thoughts, Kara. And I'm, again, I think one of the benefits in working with lots of accounts is that we we do have the benefit of a little bit more of a sort of industry-wide snapshot. So I'm kind of curious, just for a minute, are there things that you see that hold the industry back from delivering great patient experiences? Are there things that you think really propel us forward to creating those? What's in our way on this? And is there anything that we can maybe do about that? Because I know that often it can feel like, yeah, it's great that the shoe shopping experience is great. I'm healthcare. That's nice. Too bad. I don't get to do that.
I think the number one thing, I'm going to kind of flip your question. I think the number one thing that drives patient experiences forward is patients themselves, right? We can all go, I think this is what they're looking for. I think we need to surface this. But if that's not, what patients are actually looking for, then we're all going to miss the mark. And we can't, we have to tie back to who are we doing this for? Because at the end of the day, what looks super cool and super pretty for me is not what's important when somebody's out there looking for information about something that their family member has been diagnosed with.
Yeah.
So I think, how can we best assist patients through challenging times by providing clear, transparent experiences that are easy to navigate, that are on the channels that they're looking for, right? While keeping them secure is what will drive these experiences forward. And,
and target and maximize that investment, right?
Mm-hmm.
Because we can spend a lot of time and effort on something that, to your point, is not really what they want.
Right.
Yeah.
Yeah. And then thinking about what's holding us back, this is something I like to personally say, my biggest challenger is myself, right? My brain will hold me back every single day if I don't push it outside of its limits. So I think as long as we're remaining open about, meeting compliance standards and then letting the digital experience go to where it needs to go, remaining open to that future of the unknown. Sure, it's unknown, but it's going to be doable. So I think as long as we all remain optimistic and stay on top of the aspects that we need to stay on top of, I think we'll get there.
Yeah. Yeah. No, that's a great point. And I think it's easy to get in that fear-based mindset of, I don't want to go near anything that even resembles PHI because that's scary. Sort of, no, we can, we'll be respectful of this data, but we can handle it appropriately and do exciting things with that. Yeah.
Mm-hmm. Absolutely. Well,
can we jump to Q&A?
Yeah, we have just a little bit of time left.
All right, let's go for it.
So it looks like the first question, sorry there. The first question we have is, what is one of the biggest pitfalls that digital experience projects fall into?
Ooh, okay. Is that one for me? I guess that's
Yeah.
probably.
Yep.
Yeah, I think kind of what we were just talking about. So one of the common things that I see is we let perfect be the enemy of good. And where this shows up is, let's say it's a find a doc experience, and if you are in the middle of implementing one of these, you may have been tasked to implement something like open scheduling. Well, open scheduling is operationally difficult to do. It's just, we could spend a whole webinar just talking about that and the challenges there. And so, there's all this swirl about, we're not going to be able to do open scheduling. We could only do open scheduling for certain types of visits, and and all of this stuff. And we sort of get like kind of ground to a halt instead of saying, well, what if we just made it easy to see who's accepting new patients? Can we do that? Like, oh yeah, well, we can do that. Right. So I think, trying to find that pathway to, don't just give up on something because it's hard, but is there something that we can do right now that makes this better? Seize that and build momentum on those. So yeah, I think that's a big one. And then I see a great question here in the group chat here, which I'm going to punt to you, Kara. Is there a free trial for these products that we can play with?
Yeah, so as of right now, we have clickable self-demos that you can go through and kind of walk yourself through all of the Acquia products to get an understanding of, what do they look like when you get under the hood, what, where you can go to do a variety of different things, how can you access different features within the product. We will have free self-service trials available this coming fall. So got a little bit of a wait, but they are very right around the corner. Very soon, like when I say very soon, like be on the lookout for them. They're coming when you go to acquia.com today. We do have those clickable demos. And then as always, you can go in and, not everybody wants to talk to a person right away, but when you're ready, after you've done your own independent research, feel free to reach out to get a demo. Our SEs are very knowledgeable and they'll walk you through any of the products and show you exactly what you want to see.
And correct me if I'm wrong, but there's you can definitely, there's a easy like request a sandbox for Site Studio specifically as well, I think, which is
Yep. Site Studio, that one does exist today. Yep. So you can go and kind of tootle around in Site Studio to, get your toes wet, dip them into the water a little bit. Looks like we got another question. I think this one might be great for you, Caroline. So the question is there some advantages in mobile app integration for patient experiences?
That is a great question. I'm going to the really, really short version is I'm gonna give the worst answer ever, which is it depends. But yes, I think there definitely can be. I think that this is one of those things where starting with that, what are we trying to achieve? Like, what's the deficit right now that we think? So instead of a solution in search of a problem, which I think is sometimes the pitfall that I do see organizations falling into of like, well, if we don't have a mobile app, we're falling behind. Not necessarily, but yes, often. So one of the things to think about is, are you, like a really common, great problem to which this is a solution is, are you in some way increasing access to care? So are there elements of this mobile app, thing that we're thinking of here, this project, we'll say, that are really not a good fit for a pure web-based experience? And I would say one of the ones that I think where a mobile app makes a lot of sense is not necessarily, and it can be a case with something like a find a doc of just like, I'm just informational, I'm just sort of shopping around for someone. But where it really can matter is when it's my data. So my chart results, my upcoming appointments, my information, while, we can have a web experience for that, often if I need that information while I'm away, from cell service, I can't, that's not going to work for a web-based experience. It's just not, right? So there are cases where it's absolutely irreplaceable. Those are obviously very high value, but in some cases, it's just meeting audiences where there are. Some people have a very strong preference to use a mobile app. Some people have a very strong preference not to, right? It's important that both of those exist. But in some cases, this is really irreplaceable. I would say also things where I want to have native, hardware integration built in. Do I need to use your GPS, like a high fidelity GPS location? Do I need to use your camera? Are you taking a call? Is this a virtual visit? Things like that can be really, really powerful. So again, I think just being a little bit wary of the trap of sort of keeping up with the Joneses a bit, because that can be, there may be better investments, but a lot of times there can be really incredible improvements in that patient experience, that patient journey through a mobile app. So yeah, I don't know. How did I do? Did I get a thumbs up on that, or did I answer the question, I guess?
Yeah, I think you did great there.
Yeah.
So with that, we are at the end of our time today. I want to take the time to thank everybody for attending and watching and joining us today and listening to us, go on about how to create a great digital patient experience. And Caroline, thank you so much for joining today.
Thank you. And thank you very much, Kara. Always a pleasure. And as you can tell, we love to chat about this. So please reach out if you have further questions. We'd love to talk. Have a good one.
Thank you.